Vitamin D has also been shown to increase immunity. So everybody thinks that they're taking 400 or 1,000 units and they're doing the right job. Almost nobody is getting enough vitamin D unless they're taking between 3,000 and 5,000 units of vitamin D a day. I've had two patients who went over the limit of 100 micrograms, and I would say that more than 85% of my patients are vitamin D deficient, because I consider people deficient not if they're 30 or less, but if they're 50 or less. So the goal that I want people to obtain is 5,000 units. I cannot recommend that the viewing audience take 5,000. What did I say? The goal that I want the public to take is the goal that people should achieve is 50 micrograms. Just say 50. So most people are down around anywhere from 10 to 20. Getting up to 30 is a good start, but I recommend 50. The authorities say that 30 is adequate. Am I an authority? I think so, but I would encourage you to get your goal up to 50. 80, even 100 is considered safe. I've only had one patient over 100, and she's like 84 years old and just as spry and happy, and I've called her up and told her to reduce her D, and she won't do it, and she seems fine. So it's not always toxic, although it can be. Vitamin C, when people get flu or colds, I generally say 100% no dairy product. No skim milk, 1%, 2% light and lively, cottage cheese, yogurt, ice cream, white soups, white salad dressings, 100% no dairy, because it's congesting. The body must drain whether we're voiding, our bowels, cough, breathe, our eyes, wax in our ears. We have to drain things out. And milk, by alternative medicine, makes the drainage process more difficult. The way we say it in alternative medicine is it thickens the mucus so it doesn't drain. And thicken is another way of saying leading to stagnation, and stagnation always predisposes to infection. So I would encourage you 100% no dairy product. I probably don't have 5 people a year who get a sinus infection or a cold or bronchitis that haven't been eating dairy. You might say, well, yes, that's because 100% of your patients are eating dairy. No, what I'm telling you is I have large numbers of people who eat no dairy, and they tend not to be the ones who get the colds. On the other hand, when they eat the dairy, that's when then they have the bite of ice cream, when they have the yogurt, that's when they get their colds. You might say, well, it would be better if they stayed on it all the time. There may be some truth in that, but I don't recommend it, because I personally believe that dairy products are related to the development of cancer of the breast, cancer of the prostate, anemia in women because of heavy menstrual periods, ovarian cysts, ovarian cancer, uterine fibroids, prostate cancer in men, enlarged prostate in men, enlarged prostate is also related to eating sweets. But anyhow, vitamin D and AHCC, IP6, and a mixture of medical mushrooms. There's one called Host Defense, which is generally available at our natural food stores around here. The one that I'm most familiar with is from Mega Foods, which is called Maitake Gold. Maitake is a mushroom. And so that's what I'm recommending. Now here's an article that basically says most people who get the swine flu are just going to be fine. I may have said this to you, and you may recall that polio was not always the paralyzing disease that people saw with patients going into the respirators. Polio came in small, medium, and large, like everything else, like the regular flu, like the swine flu. It's not like smallpox, where if you get it, you've got a real problem on your hands. Polio used to be the common cold, a little bit of cough, a little bit of flu, and that was it for most people. But some people were very adversely affected, and they got the muscle wasting and even had to go into respirators because they literally could not breathe on their own. So most people, it says, are going to have a little bit of a problem. When you do, remember what I said, AHCC, IP6, vitamin C, 500 milligrams 3 times a day. Taking probiotics during the flu period will increase your immunity. And so I recommend taking probiotics just anyhow, and digestive enzymes can be a help. I mentioned curcumin before, echinacea, andrographis, AHCC, IP6, but you can't do all of those. So it's sort of like pick and choose.